So one of the most important lessons I learned early in my orthodontic career is that there is no single orthodontic appliance that works for every patient. Every patient is different and every problem is different, so the solution should be different too. That's why I am cautious when I hear labels like an aligner orthodontist, a non-extraction orthodontist, or an expansion orthodontist, or a functional appliance orthodontist, because orthodontics should never be defined by tools. You wouldn't expect a surgeon to perform every procedure using the same instruments, and orthodontics is no different. Everything starts with diagnosis. So if the problem is not identified properly, then it doesn't exist in the treatment plan. And when that happens, the treatment is flawed from the start. Take a simple example, trying to fix a transverse width problem with aligners. This is like trying to dig a hole with a spoon. If you use the wrong approach, you might get a result that looks fine at the start, but over time, we will start to see instability, relapse, and sometimes damage to the teeth and the supporting structures. And that's why at Lusk Orthodontics, we try to use every orthodontic tool available, whether it's STAD, functional appliances, normal braces, lingual braces, but we will always start with the diagnosis. That being said, we don't force a treatment on patients. At the end of the day, it's the patient's choice. My goal is to guide you. I will explain your ideal treatment based on your diagnosis, and I will explain why, and then we discuss alternatives. Because sometimes we have to accept certain compromises. That might mean a simpler treatment or a trade-off in aesthetics or quality of bite. But what matters the most is that you understand your options and you make an informed decision. Because in the end, this is not about the appliance, it's about making the right decision for you. And as they say, in orthodontics, diagnosis is always king.